13, and we are doing our project for the Living History of Pharmacy, ages 20 to 29, and we have Miss Samira here, pharmacist with CVS Pharmacy. We want to thank her for her time today. Thank you for volunteering to do our questions.
Sure.
I wanted to start out and ask you, what were your requirements for your degree when you earned it, when you were in school?
The same requirements for you guys. So 2 years prereqs, 4 years of pharmacy.
Okay. And can you tell us a little about what pharmacy school was like for you when you went?
I wish I could go back to pharmacy school.
Why?
Work. I think it was tedious, but I mean it was manageable. I think there was a lot of curriculum changes when I went. I went to Florida A&M, so it was difficult in that aspect because it was kind of disorganized in that way. But aside from that, I mean, I enjoyed it all in all. I wish I could go back to school.
Aww.
Yeah.
It's so funny. One of the pharmacists I work with, she had said to me, she goes, "Oh, enjoy it now, because when you're working, it's going to be completely different." So
yeah, exactly.
I understand what you mean.
Liability, yes.
Yeah, right. When you graduated, what was the political, social, and economic state of affairs in our country, and how did you feel that it affected pharmacy?
I feel, okay, first of all, the MTM, I think that really helped, and it was kind of popping off then. I know there's a lot now. A lot of practices, a lot of ambulatory clinics are having a lot of MTM therapy, which insurances are reimbursing. That's important because it kind of broadens our field. As far as maybe political aspect, the Obamacare just being enacted now, I think that's different, but it's kind of in the beginning stages, so we don't really know how much it's going to impact the pharmacy field. Really, there's everything's pretty much the same, yeah. Pretty much the same, I think.
Okay. Well, what were some of the pertinent issues facing pharmacy so far during your career, would you say?
I think the most permanent, well, first of all, the tech to pharmacist ratio, of course that's changing with the Board of Pharmacy. That's very pertinent, especially at retail, because we know we need a lot of help. Yes. Other pertinent issues, hydrocodone, the C2 hydrocodone, I'm sure you guys know now. What else? The hydrocodone is being locked in safes now. Yeah. That's, those are pertinent issues, especially because it makes, your retail or any other pharmacy more difficult.
Definitely.
Right.
Well, when you decided, tell us why you decided to become a pharmacist, and what educational degrees have you earned, and from where? And what, I know you said you went to FAM, but what has been the path of your career to date?
Okay. I went to Georgia Perimeter College in Atlanta. I transferred to University of Georgia. I was doing my bachelor's in biochemistry. I wanted to do a minor in international affairs, which was random, but I never continued. I just applied straight to pharmacy school. Never applied to any school in Georgia, just decided one day I wanted to move to Florida, and I never applied to any other pharmacy school except Florida A&M. I got accepted, continued, and this is where I am today.
Oh, great.
Yeah.
Good. We're very lucky. So.
Yes. Straight path.
What are and were your typical daily roles and responsibilities in your field of practice?
Everything we think a pharmacist does plus 20.
Plus 20?
Plus times 20, actually, exponential. Oh. Besides checking voicemails, counseling, giving flu shots, giving shingles vaccines, giving pneumonia shots. What else is there? Sometimes even checking people's blood pressure, even though we don't do that. What else? The whole slew of things for like scripts and all the good stuff, verifying. And a lot of metrics, business metrics that we have to follow at CVS here.
Yeah, I think any retail too.
Right, I think they're all trying to shift towards that, yes.
It's almost like you have you have to have a business background to be able to, handle the responsibility of what the retail demands, so.
Exactly.
Yeah. It's very diverse, even though people don't understand that.
They don't, no. And you don't get special training, so it's kind of something you have to learn on the job. Yeah,
learn or sink or swim, basically.
Sink or swim, exactly. There we go, perfect.
But what roles does the technology play for you? I mean, with now everything being so accessible with information, tools and apps that the pharmacist can use in practice, what has been important to you in your role of practice? Or stuff that you use like here too at CVS?
Right. Our system that we have here is called WeCare, so it pretty much manages everything, and it's pretty user-friendly. I feel like that's all we rely on anybody who has retail experience knows once the system goes down, you can't do anything.
Anything.
So it's kind of, yeah, that's everything to you. We don't have a robot. We do have a dose counter, so I guess that's also technology. It's automated. It does kind of decrease our workload. Of course, it does take a lot of special handling because it gets stuck a lot. I hope we never get a robot because that's obviously not going to be good for the pharmacy field. So
Right.
that's technology for us.
Okay. Well, what opportunities existed or exist for interprofessional interaction and collaboration among yourself and other healthcare professionals, if there's any?
Majorly with nurses, especially when we're verifying prescriptions or so on and so forth. Doctors, when they're trying to figure out formulary checks, anything, drug interactions. Yeah. I feel like we pretty much are the middleman on everything. So.
Okay.
Yeah.
What challenges do you think the profession is currently facing? I know you had mentioned before, like the tech ratio.
That's number one.
NTMs are becoming a little bit more prevalent and popular.
Mm-hmm.
We had discussed, I don't know how you feel on this, but how things are going to be going with provider status, hopefully.
Mm-hmm.
What are your thoughts on that?
I feel like, I know some states, first going with tech ratio, I believe there's one state that has this law. If a pharmacist fills more than 350, then there's mandatory a second pharmacist. I think that's a good thing to enact in Florida, personally. So yeah, that's number one. That's the biggest challenge that we have because our job is so comprehensive. People just think it's, pretty much fill, verify, buy.
Yeah, exactly.
And it's definitely not the case. I'm sure you already know.
Yes,
That's the most important issue.
Yep.
That's the only issue that I am concerned about right now.
That's so true.
Yes.
I think too, ultimately our goal is we want the safety, and so many things kind of get blurred into that take away from that focus.
Exactly.
So
exactly.
hopefully that bill will
Yes.
get taken care of the right way. So
Exactly.
Well, what are your future professional goals, if applicable, at the moment, or?
I am contemplating doing a residency.
Very good.
So, but I highly doubt that. That's like a less than 2% chance. I always wanted to be in academia, actually.
Okay.
Yeah, and the second thing is, probably maybe an ER pharmacist or something that requires 2 years residency, but still. That's my.
Oh, great.
But for now, this is where I am.
Okay, perfect.
Yeah.
Perfect. And what are your hopes for the future of pharmacy, and where do you see our field going? You kind of mentioned it a little bit, but.
Right. I hope that in the retail aspect we become more of clinicians as opposed to just doing what we do, because we do a lot of clinical data, a lot of clinical stuff, but it's not recognized. So I hope that those hours are counted into what we do on a daily basis. And for the future of pharmacy in general, I hope that the main thing besides the technician bill, I hope that in general that residencies are actually, I don't say mandatory, but I hope it's pushed more and more. Because I feel like when we were in school, it was there, but it kind of wasn't.
Yeah.
It's one of those things you have the option. I hope that becomes the case.
Yeah, I
hope it's not mandatory, but I hope it's something that you need to push for.
They had
people don't know.
mentioned actually with residencies how it's now with the way everything's going with pharmacy, how much more of an asset it is, for diversity. But one of the things you said too is that, which is the absolute truth. Hopefully the field of pharmacy will become more aware to the public how vital we are. Not so much just clinical, but just every day.
Exactly.
And how we play a role in their everyday health.
Exactly.
Yeah.
Exactly.
Well, thank you so much.
No
Thank you for your time.
No problem.
And again, we appreciate your answers. And hopefully we will see you next year.
Hopefully, yes. I don't
Thank
know
you.
that, but yes. Thank you.